breast reconstruction patients, so what should they expect when they come to you? How do you treat them, approaches, et cetera, et cetera? Give me some information about that.
The patient takes time with my team to talk about their life, to talk about their diagnosis, to talk about their family. Then they meet with me for about an hour, and we talk about the journey that they've already been on. I ask them to tell me more about their lifestyle, their concerns, and I would like to find out what's important to them. For some patients, they want to know if I can get this entire reconstruction done in one step. For other patients, they want the best aesthetic result that they can get. And of course, every patient is naturally very concerned about safety. And so in my practice, we're focused on how to safely deliver a natural looking result that'll stand the test of time. So the first thought is always about safety. The second thought is this result going to heal well and stand the test of time, and is it going to be oncologically appropriate? So I work with the oncologists as well as the radiation oncologists.
For patients that might not know, what's an oncologist?
Yeah, sure. So the oncologist is the cancer medical doctor who helps make decisions based on medical literature, evidence-based decisions. Do I need chemotherapy? What kind? What are the benefits for radiation? Will that help me? Will that reduce the chance of local recurrence or distant recurrence? And so they will be the coordinator, like the primary care doctor almost, of that cancer treatment. And they coordinate all the different aspects, surgery, radiation, chemotherapy. And they'll deliver the chemotherapy. So the patient meets with me, and sometimes I act like the navigator, and I help them figure out all of the different steps that they need. Sometimes I meet patients who just have been diagnosed with breast cancer and they're not sure where to start. And I kind of help them get through the process. I have 2 breast cancer survivors on my care team.
Beautiful.
And so they are the first contact. So when a patient calls my office, the first person they'll talk to is Claire. Claire is a breast cancer survivor who's young when she had her diagnosis. She underwent chemotherapy, radiation, and had a living tissue breast reconstruction called a DIEP flap. And Claire is going to spend a lot of time taking the patient through the first steps of the reconstructive process.
I love it.
Then when they come to the office, they'll meet with Claire in person. And then I'll meet with them for about an hour and we'll talk through everything. Once we get all of the pieces of the diagnosis and treatment plan from the oncologist, that's when we make our reconstructive plan final. We get the surgical date, and I coordinate that with the other cancer surgeon so that we're able to do all of the reconstruction on that first day in most cases. We design the reconstructive plan to deliver a natural-looking result from the first step. And so that's an important thing for the patient to understand, is that a beautiful, natural-looking reconstruction has to be designed before the mastectomy in most cases to get the correct footprint of the breast, to get the correct cleavage and lateral contours, and to treat the tissue in a way that you end up with a hidden scar pattern that can result in a truly natural-looking result. So those are the ways I approach reconstruction. I approach reconstruction in two things are in mind with every patient. Is how can I safely help this woman get the best and most natural-looking result that she can get? And what would I want for her or suggest if she was my family member? And so those aspects are in every consult with a patient. I spend a lot of time listening to her and talking to her, and if she brings a caregiver, a family member, we speak to them as well and talk to them about recovery. We talk about the timeline. We talk about the long-lasting result that might be expected, and the risks and benefits of each surgery, and then we look at results. I'll show a patient 5 or 10 different other patients who've given me a consent to share their results so that the patient understands what they might expect. Some of those results are online, but in many cases, I can tell a lady, hi, if you have left-sided breast cancer and you have middle skin tone and you have this and that with your body shape, I can find 3 other patients who, in my practice, who actually have the same side cancer, same skin type, same body type. This is what I expect that your result will look like.
Perfect.
Because she also had radiation. She also had a mastectomy. She had an implant, or she had an implant reconstruction just like what we're planning for you. I've done over 1,000 breast reconstruction cases in the last 5 years in Austin.
Wow.
And I just feel like I feel grateful to be a part of each reconstructive patient's journey.
Yeah.
And I really enjoy the ability to deliver a natural-looking, safe result with each patient. Yeah.
Beautiful. I love it. Thanks for sharing that. So it sounds like the holistic approach, starting from the beginning, getting them in the beginning, not coming in and helping doing the reconstruction after, but you're building this program from the beginning to get the best results in the end.
Yeah, and to do that, I work closely with each level of the patient care team, with the radiation oncologist, with the oncologist, and with the primary care doctor, so that the patient's journey is sort of a unified journey between all of the physicians.
Yeah, it feels very personal, empathetic, especially with the two patient care coordinators that you had that you said have gone through cancer as well.